Hello, my name is Jed Meadows. This is video 2 of 4 and of talking about the National Asthma Education and Prevention Program. And in this video, we're going to be talking more about asthma, like diagnosis and care and stuff like that. Well, first things first, key clinical activities for quality asthma care. So this is the diagnosis. So you want to determine that symptoms of recurrent airway obstruction are present based on history and exam. You want to make sure you want to see if there's a history of cough, recurrent wheezing, recurring difficulty of breathing, recurring chest tightness. Symptoms occur or worsen at night or with exercise, viral infection exposure to allergens and irritants, and changes in weather, hard laughing or crying, or stress or other factors. In all patients that are greater than 5 years of age, that you want to make sure to use spirometry to determine that airway obstruction is at least partially reversible. And then you want to consider other causes for the airway obstruction, like tumors, other stuff like that. Asthma management long term. So you want to reduce patient impairment. You would prevent chronic symptoms, requiring frequent use of short-acting beta-2 agonists. You want to maintain near normal lung function and normal activity levels. So we understand that because of the disease this patient has, they may not ever get back to so-called normal, but you want to keep them to like as close to it as possible. You want to reduce risk. So you want to prevent exacerbations, minimize the need for emergency care, hospitalization, reduce risk, prevent loss of lung function, and minimize adverse effects of therapy. Continue. So also on initial visit, you want to assess the asthma severity to initiate treatment. You want to follow up visit assess asthma control. Or for the follow up visit, you would like to assess asthma control to determine if therapy should be adjusted. You would then assess at each visit for asthma control, proper medication technique, written asthma action plan, patient adherence, and patient concerns. Then you would obtain lung function measurements by spirometry at least every 1 to 2 years or more frequent, like stated earlier, depending on how severe the asthma is or if it is not well controlled. You would want to determine if therapy should be adjusted. So you would either maintain step up or if you needed to step down. Drugs. Okay. So select medication and delivery devices that meet patients' needs and circumstances. Inhaled corticosteroids are often the most effective long-term medication. When choosing treatment, consider domain of relevance to patients. So, like you want to make sure to check their risk, impairment, or both. Patient's history of response to the medication and willingness or ability to use the medication. Asthma care for special circumstances. So one of the special circumstances we're going to be talking about two. We're going to be talking about pregnancy and EIB. So EIB is exercise-induced bronchoconstriction. This is more commonly referred to as exercise-induced asthma. Exercise should be encouraged for these patients, but for most patients, EIB shouldn't limit participation in these activities. So you want to teach patients about the appropriate time to use the treatment. So before exercise, a lot of time with people who have EIB, you would hear them say, well, I was running and I just ran out of breath. I went for my daily jog and I just couldn't breathe. So you would instruct them that before they go on their daily jog, you would definitely take your broncho and you would want to take your inhaler. For cold-induced IAB, encourage patients to participate in a warm-up period or to place a mask or a scarf over their mouth. So with patients like this, cold weather can just hit them like that, and they can really do it. So they're breathing in that cold air. If you put that scarf or mask over your mouth, you're breathing in more warmer air. Now, the other special circumstance we're talking about is pregnancy. So asthma can improve or worsen during pregnancy. You don't really know either. So to maintain asthma control throughout pregnancy, you want to make sure to check asthma control at all prenatal visits. And then treating asthma with medication is safer for the mom and the baby rather than having like poorly controlled asthma. So it's very important for pregnant women. Managing exacerbations. So there are two types of managing exacerbations. So if you're at home or if you're in urgent emergency care. So for the home, you want to develop a written action plan. You want to teach patients how to recognize early signs and symptoms. You want to teach them how to adjust medications if needed, monitor the response, and you want to tell them they need to seek medical care if there's a serious like detrimental or lack of response to treatment. Uh, or you can go the urgent and emergency care way. So you want to assess severity by lung function measures, physical examination and signs and symptoms to treat or treat to relieve hypoxemia and airflow obstruction. You want to reduce airway inflammation, and you want to use supplemental oxygen to correct hypoxemia. You want to treat with repetitive or continuous SABA, so short-acting bronchodilators, and or systemic corticosteroids if needed. And that is it for that video. Thank you very much.